Thank you everyone for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I'll be your moderator today. Today's Learning Lunch will cover Legacy EMR, what are my options? We're joined today by Brad Benson of Health e-Formatics, a Chicago-based healthcare IT consulting company specializing in EMR data conversions. Brad has many years of real-world experience in EMR data conversions, and we're honored to share his expertise with you today. Remember that you can ask questions of our presenter at any time during today's session by entering them into the chat area during the presentation. In the second half of our session, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent via email link later in the week. Also, note that all registered attendees of today's session will receive an email with links to both the slides and recorded versions of this event. So we often have folks ask us if they can get the slides or see a recording. Not to worry, we'll follow up with that information and send it along to you via email. All right, Brad, well, thank you for joining us. First of all, it's a pleasure to have you here.
Thanks, Brian. Really happy to be here.
All right, well, I know that you wanted to begin by sort of introducing the subject before we get into the questions. So why don't you go ahead and begin with sort of a lay of the land for EMR data conversion.
Okay, sounds good. Yeah, well, thank you for that, Brian, and welcome everybody. Excited to be giving this presentation here today. Yeah, I wanted to spend the first couple of minutes just talking about legacy EMR data conversions and why this is a big topic right now and why there is such a need for this right now. And then just briefly discuss who the audience on this webinar is likely comprised of. So my assumption here is that people who are attending this webinar are people who are considering changing EMRs or people who have already decided that they're going to switch EMRs, and also potentially people who have already switched EMRs and may have a second or potentially third EMR, legacy EMR that's still up and running, and you want to be able to do something with that data so that you don't have to leave those EMRs running out there forever. And so this webinar session is going to is for all of those people, anybody who has changed or is looking to change. Switch EMRs, and you know, talking about why this is such a big issue right now. So you know, there's a lot of people that are switching EMRs, and the main reason that we're seeing that people are switching is really that their current EMR is not meeting the needs of the practice. So that's the number one reason that there was a black book study that was done to find out why are all these people switching EMRs, and that was the number one reason. You know, wanted to just kick that off as sort of that's what I'm going to be addressing, and talking about what all the different options are for those organizations that either are looking to switch EMRs or have already done so.
Well, then maybe we should get into the first question here because it, you know, dovetails nicely with that. What should a healthcare organization consider as they address this legacy EMR data issue?
Sure. So there's a number of things to think about. You know, you are definitely going to be you have to do something with your patient data that exists, and it's not as simple as just saying I've just got to pull out this data and I've got to move it over to here. So some of the things that organizations need to consider when they're going into an EMR conversion is they need to consider the legal record of their legacy EMR data. So they need to make sure that those patient charts are always accessible. State requirements require practices to keep their data for anywhere between 7 and 21 years. So there needs to be a strategy behind maintaining that legal record there. There is the need to have a continuity of care. So you want to make sure that whatever you do with that old data, whether you put it into your new EMR, whether you store it into an archive solution, that data is easily accessible so that your providers can continue to give proper patient care. So I'm going to talk a little bit about ways to make sure that data is easily accessible. proper planning behind it. There's a lot of excitement around potentially changing to an EMR. I'm sure a lot of stresses as well, but you know, and the functionality that you're going to be able to get. But a lot of times the consideration of the data is really an afterthought, and that needs to be part of the upfront planning for your conversion. The fact that there's going to be multiple parties involved here, you know, we are an EMR conversion company, and we typically do, you know, extraction and mapping of the data, and sometimes we do the import, but not always. You may be dealing with, you may need some assistance from the EMR vendor that you're currently on. You have EMR conversion companies such as ourselves involved, and then you'd also have, you may need some assistance from the target EMR system, and so you may need information in terms of what you're able to import into their system. So there's a lot of coordination that needs to take place, and that's why it's important to do this upfront planning. The fourth component here is having conversion expertise. So organizations who are going through an EMR conversion, in most cases, they've never done it before. This is the first time. So they typically don't have the knowledge of what's important to and what you need to consider for a conversion. So having that expertise, or bringing somebody in that has that expertise, somebody who's going to be able to really educate the organization in terms of what options are available, so that they can make the most appropriate solution for their organization and their needs and what they're trying to do with the conversion. And then how do you ensure that it's going to be a successful conversion? I'm going to talk about this in a little bit, but there's a lot of resistance to conversions and sort of this idea that they don't work and they're too difficult. So I'm going to talk about why that has been the case. You know, for some organizations, and why it hasn't worked, but I'm also going to talk about some real success stories and why, you know, what are the key factors for making sure a conversion is successful.
So you were just talking about this, that, you know, there's a lot of word out there that EMR conversions are challenging and they often don't work out. What are some of the things that can go wrong in an EMR conversion?
Right. So a lot of times, you know, like I said, organizations haven't been through it, so they don't know what the right questions are to be asking about a conversion. You know, a typical example here is you've got a number of things you can do with your old data. You know, you can put it into your target EMR, you can put it into an archive solution, you can put it into a summary document. But what's going to be the results of the route that you choose to make? So you want to make sure, if you want to make sure that drug interaction checking is going to continue to occur on your medications, those have to be within the target EMR system. You know, and the other example is allergy reminders and alerts. So there's particular modules, is what we call them. You know, that would be a medications or problems listing or allergy listing. And some of that data you definitely want to have within the target system that you're moving to. And some you can get by having it in an archive solutions. But what's important is that those questions are thought about up front. And without that, a lot of times what will happen is organizations will go through the process of switching EMRs, perform a migration, and realize, you know, that they're not getting the result that they need to be able to get meaningful use out of their old data. And then ensuring against the data loss during a conversion. You want to make sure that every component and every piece of data that is within your legacy EMR is retained in some fashion. So really thinking through that process and what you're going to do with all of the different data elements there. One of the really important upfront analysis items that needs to take place is a feasibility assessment. So understanding what is it that, you know, how is all the data going to be extracted out of your current system? What are the options and what data can be brought into your target system? And how nicely are those two EMR systems going to play together? Are all the fields going to be accounted for, or are you only going to be able to put a subset of your information within the target system? So really doing that feasibility assessment of what can successfully occur occur in terms of migration, and then having a strategy for those items that may not be able to be imported into the target system. As well as having a bulletproof testing process here. So what, it's not, one way to think about it is, just getting it done, just getting the data out and shoving it into the target system here. And a lot of times what happens is people get to go live and they realize that the data is not in the place they thought it should be, or or they haven't had physicians look at it, really look at prior to the conversion of the data and sign off on it and say, yes, this is exactly how I need my data in this target system. And so part of that bulletproof testing is you're going to need really a chart-to-chart comparison, pulling up your old system, looking at the chart, making sure that the new system has all the data elements that you need, and doing all of that testing prior to go live. And as I mentioned before, one of the reasons that they fail is data conversion when it's an afterthought and you haven't done the proper planning up front for your conversion and thought through everything that needs to happen and is going to happen, and is the final solution going to meet all the needs that you have as an organization.
Now, why is it important that clinical staff be involved? Is it to be sure that all the data that they use is included in the new system, or maybe you could share a little bit about that with us?
Sure. It's really because they're the end user. They're the ones who are going to be using that information. So you want to make sure that what they see in that target system is what they expect, and the data is where they expect it. If it's not intuitive for them and they're looking for pieces of information in the old system that was in one place, and in the new system it's called something completely different, and there's going to be confusion there, or they're not going to be able to get to it as easily, that can impact patient care. So you want to make sure that they have seen, and taken a look at how the data is going to be represented in the new system.
That makes sense. So what are some options then for how people go about doing this? Maybe you could give us a rundown of sort of the main choices people face.
Yep. Yeah, so the simplest choice is to leave the old EMR up and running. Obviously that is not something we recommend, but it is an option, and it is what a lot of organizations do who don't really understand all the different options that are available to them. Another option that organizations have is just doing a manual chart abstraction, pulling charts out of the old system and importing them as documents, or hand typing them into the target system. So those are really the simplest solutions that don't require you to do anything, but they don't get you the results that most organizations require. So the main options that I'm really going to be talking about today is a discrete data conversion, which is where you are essentially pulling out that data through queries or whatever methods you have to get the data out of the target system, and then placing that data within the database of the of the target EMR that you're moving to. And some other options, and that's really the best, most preferred use of your data, is having that data actually reside within the database of the target system. But it's also the most complex, so it's not always the appropriate solution for all organizations. Summary reports is another method. I'm going to talk a little bit about that and the kind of the pros and cons of that. That's really where you're either generating a CCD document, or you're placing the problems list and allergies list in a document and then moving that document over to the target system. Legacy EMR Data Archive is another solution there, and really this is placing all of your data or a portion of your data into a legacy archive application that typically can be accessed directly from the new EMR that you switch to. pluses and minuses to that, but it is a good way to make sure you retain your full legal record. And then the final option is a hybrid solution. So you're basically looking at all of your individual data modules and figuring out what makes the most sense. It may make sense to bring over 2 or 3 of your modules, let's say problems and allergies and meds, into through a discrete conversion, and then move everything else into your legacy data archive.
So what are the pros and cons then for each of these options?
So for when leaving an EMR up and running, I'll be brief about these first two because it's pretty obvious. So for leaving your old EMR up and running, you don't have to dedicate funds for a conversion. You're just basically leaving it there. The problem is that you're going to have to pay ongoing maintenance and support to that old vendor to keep that system up and running, and that can include licensing. That just includes maintenance of the servers on an ongoing basis. And then your data is in a completely separate system, which is an issue in terms of ease of access there. You don't want your physicians to have to log into multiple systems to pull up all of the information. In terms of the manual entry and chart abstraction, the pro of that is you do get all your data in the target system there. So in terms of ease of access, it's right there just as if it was entered into that system to begin with. The problem is it takes a really long time to do that sort of thing, where it's anytime you're doing a manual conversion of the data, it's going to be a long, resource-intensive effort to accomplish that. So in terms of the discrete conversion, as I mentioned, this is a really good solution in that you're getting that full EMR functionality on the new data, drug interaction checking and the allergy reminders. The data is right there, so you have ease of access to all of that information. And then you can actually use all that information for ongoing reporting within your system there. Some of the cons of that is, as I mentioned before, it can be resource intensive. It is requires a large amount of conversion expertise because it is a complex process that needs to take place there. When you're dealing with two systems, as I mentioned, in terms of compatibility there between the two systems, in terms of are they using the same coding systems, and how nicely are they going to play together for a discrete conversion. So for the summary documents here, it's a pretty cost-effective solution. It's a pretty simple solution. You're really grabbing your data out of your source system there, and you're placing them into either one document per patient, or maybe you've got a problem list, a medication list, an allergy list that you're moving over as documents. So it's a pretty cost-effective solution, but there's a big downside to it, and that is, one, you may be dealing with information that is, you may be dealing with very large documents where it's really hard to find the information that the physician may be looking for there. And then you don't receive the benefit of that full EMR functionality that you got with the discrete data conversion. That data is just within documents, so you're not going to get allergy reminders and drug interaction checking. So the legacy EMR data archive solution, that I talked about a minute ago, that has a lot of pros to it. So this is a way that, as I mentioned, the link out to archives can typically be built right into your target EMR there. So if you're on a particular patient, you may be able to just click a legacy data link that will bring up all of their historical information. That data is typically stored somewhere else in an archive solution, but it can be accessed directly from the target EMR there. So it's a pretty effective or cost-effective solution. You still maintain that ease of access with a single click to get all of your old information there. And with that, you can turn off your old EMR system. So as long as you move all of your data over to the legacy or the legacy EMR data archive there, now you can turn off your old system. You don't have to pay ongoing support and maintenance of it. And finally, the hybrid solution there. that's a combination of these. As I mentioned, figuring out what makes the most sense for that particular module. What's the pro of that is you can tailor your conversion to what makes sense for your organization. Different organizations have different needs and different things that they're trying to accomplish with their EMR data conversion, and what's acceptable and not acceptable for them. So the hybrid approach allows you to pick and choose what makes the most sense for each level there.
So what's the most popular option then in the organizations you've worked with?
So what we see as the most common option is the hybrid conversion, and this is, as I mentioned, you can look at each individual module and figure out what is appropriate there. A very common example, or scenario that we do is organizations want to be able to maintain that full EMR functionality on allergies medication. Allergies on problems and on medications. So a lot of times what we'll do is we'll do the discrete conversion portion for those particular modules, and then we'll do everything else into an archive solution. Sometimes also patients may want just a CCD, just a summary of that patient chart as a document. So we can either put that into an archive solution or move that over to into the target EMR there. So typically you don't find for conversions where an organization wants everything moved discretely over into the target system. And typically you don't find where they want everything just moved into the EM archive. It's usually a hybrid of the two there. And the fact that that data is easily accessible through an archive solution makes the hybrid approach very attractive for a lot of organizations.
So you were just talking about CCDs. How useful is that output when it comes to a conversion?
Well, it can be extremely useful for getting the core information of what's needed. So let's say that in the example that I just gave there, they wanted to be able to move problems, allergies, and medications over through a CCD. So what's nice about the CCD is most EMR systems have the ability to produce a CCD, and then more and more systems are able to consume a CCD into their EMR. And so it's a pretty easy way to get the core information into and out of, between systems there. The downside is that it doesn't typically have all of the fields that are needed to bring over information. So, for example, it may or may not have all of the annotations associated with a particular model, or all the versions of that annotation associated with a particular module. So you want to be able to make sure that you capture as much information as possible, and the CCD typically isn't able to bring over everything that you might need. So it's a good starting point, but it's typically not the final comprehensive solution for migrating data between EMRs.
So when an EMR that can import a CCD, when it does that, that's live data then in the EMR. That's structured data for the elements it can cover.
Correct. Yep. Yeah. So you'll get you will get that full EMR functionality on the data that it's able to bring over discretely, assuming that and when I say discrete there, I mean basically parsing that CCD information and putting it into the appropriate tables within the target EMR system there, rather than as just taking a CCD and placing it in the system as a document. Which doesn't have nearly the value of parsing it. So most EMR systems nowadays are, or at least they're getting to the point where they're able to consume CCD data and parse it and place it into the appropriate tables where you can get the full EMR functionality on it.
So for organizations that have multiple acquisitions, and there's a lot of that going on now, what is the simplest conversion option for those groups?
Sure. Yeah, so what you see a lot of times is when acquisitions are occurring, the acquired practices may have, or typically are using totally different EMR systems, right? So every time you want to incorporate their data, their legacy EMR data into the new system, it's a different conversion each and every time there, and that each one has to be taken on a case-by-case basis. So in terms of the simplest option, and an option a lot of organizations are going with, they're incorporating the archive solution, and this works really well because they can bring in data from multiple different types of EMR systems into a single location to access all of that information. So that works really well. Like I said, it's a simpler solution than trying to perform a full discrete conversion on all of that data, and it allows them to have a central location of all of their different EMRs. Without something like that, say an organization decided to just leave those EMRs up and running, now they've got all their data, in separate EMR systems across the organization, which makes reporting extremely difficult, which means they have to log into multiple systems to get the full comprehensive record. And with an archive solution there, it's easy to, or a lot of them allow you to combine the patient data across those different legacy systems into one single view. So it's a really nice way to be able to see the full chart of that particular patient.
So how is the government involved here? They're promoting interoperability so that EMRs can talk to each other better. How is this going to affect conversion then?
Sure. Well, that's what's been going on here for a while there is the government trying to push for the interoperability between EMRs. They don't want practices and hospitals to be stuck with a particular EMR and not be able to remove their data out of there. And so that they're trying to push for the flow of data, between EMR systems. And so really what they've been pushing for is the standardization of the format and the coding systems that EMRs are using, and obviously there's some vendor resistance to that. They don't want data being pulled out of their system easily and making it easy for people to switch EMRs there, but it's the best thing for the organizations to be able to switch if they need to. So I think that it helps tremendously in terms of, as I mentioned before, sort of that starting point of being able to move the data from one EMR system into another and start getting that full EMR functionality. But as I mentioned, it's limited. You're not going to be able to pull all of your data via a CCD and place all that data into the target system. So it really, the way we see it as it becomes an enabler for data migration, but it's not going to give you the full comprehensive solution. So you're still going to have some sort of a hybrid solution that's necessary, whether that's CCD along with a just an archive solution, or a CCD and then a partial portion that's discrete, and then the archive solution.
So what are the keys then to a successful conversion?
So as I've talked through here, it's really making it a priority up front. Understanding that a conversion it's a complex solution. And it requires the appropriate attention, it requires the appropriate resources involved. So starting that planning early and making sure that you have a strategy in place for go live for the EMR switch. As I mentioned, what's really important is the assessment that's done up front to feasibility assessment to determine the compatibility between the two systems there, and understanding how nicely they're going to play together. Really just knowing your options You know, as I said, this is typically organizations entering an EMR conversion. This is likely the first time they've ever done this, or hopefully they haven't had to do more than one. But really not understanding what your options are there so that you can make the appropriate decisions for your organization in regard to your conversion. And understanding, along with that, knowing the pros and cons of each of those options there. You know, it impacts the patient care. You know, the decision that you go with impacts the price, you know, that a conversion could potentially cost, and it impacts all the things that I mentioned in terms of ease of access for your physicians. The things that you really care about, you want to make sure are taken care of, and so understanding those pros and cons is really critical for knowing the appropriate solution for you. And then the final thing that I would say is key for a conversion is getting those physicians involved in the testing. They don't have to be testing every field, you know, and making sure that every field is coming over accordingly, but they do, you know, we definitely recommend getting them involved in terms of sign-off. So having them coming in, taking a look at and doing a chart-to-chart comparison there, making sure that the data is in the locations that they need it to be so that there's no surprises when go-live occurs and they don't see all the data that they expected to be there.
So I think it'd be helpful for our audience, I know it'd help me understand, if you could walk us through what a typical conversion might look like.
Sure. So I guess I'll just give an example here of, I'm not going to talk through the entire process of the conversion because it is fairly complex, but at a high level I think it would be good for everybody on the call to understand what takes place, and so what they can, I'd like to give this example so that they can just kind of know what to expect coming into a conversion. So there was a community health center that we were replacing their current EMR with Athena Clinicals. It was a 23-provider group. They had millions of records in terms of the clinical data records that were out there, as well as their scanned images and their documents and office notes. So they needed to migrate most of their data over to Athena Clinicals, and they already had a go-live date set, which at the time was 2 months away when we were brought into the project. And there was a lot of unknowns here. You know, all the things that I've talked about, they weren't aware of even all the questions that needed to be asked, and there was a lot of issues that needed to be worked through within a short period of time here. So that was really the situation that we were in. Can you flip the slide real quick here, Brian?
Sure. I want to ask though. So you talked about the importance of planning, and without getting into too much detail, I'm just curious if they plan to handle it themselves and realize maybe they were in over their heads, or they just didn't plan ahead, because 2 months doesn't strike me as a very long time to bring you in and say, here's a mess, right, help us fix it.
Yeah, I think it was a combination of both. I think that they did think that they could do some of it themselves, and so they were, they had made some progress there as well. They had taken a look at their data. They did have a plan for how they would get their data out. But I think that there is some, as I mentioned, without having been through the process and understanding the complexity of it, there's probably a little bit of overconfidence there in terms of how quickly these things can be done. We've talked with certain practices that say, well, it should be easy. We're just pulling data out of here and putting it over here. But until you really think through all of the potential scenarios that can be encountered, and until you think through the realization that there has to be a compatibility assessment that's performed on it, and there has to be a real strategy behind it. So it really is not just pulling data out of here and putting it over here. There's a lot that needs to be thought through. And so that is why oftentimes it's sort of the urgency or sense of urgency that's brought to the conversions doesn't happen until it's a little bit too late.
All right, well, please continue then and tell us about your approach for this project.
Sure. So we have a process that we call the right path process to ensure successful conversions. And that particular process really involves performing that upfront assessment that I talked about, which was performed with these guys. So we came in, we talked to them about what they were trying to achieve through the conversion here, making sure that all of those requirements were defined, making sure that all the scenarios that they had concerns about, and when we started talking with them, we realized that they had a lot of concerns that were being brought to the table that they really didn't know what they were going to do about. So we wanted to make sure to address all of their concerns, and those conversations occurred with both the IT people, those conversations occurred with the physicians, to make sure everybody's concerns were being addressed here. For this particular organization, we defined a hybrid solution. We thought that made the most sense. I think we brought over about 4 or 5 modules discretely, and then everything else was put into the archive solution. And so what we did, we helped them with the test cases there. We facilitated what's called the mapping process, which I haven't really talked about here. So everybody on the call is aware, mapping can be thought of one of 2 ways. One is just sort of the field-to-field mapping that needs to take place to make sure that your allergy description shows up in the allergy description in your new system. The other mapping that needs to take place is in regard to the coding system. So if you have one system that's, say, on a medicine-based problem list, and your target system, or the EMR you're switching to, is ICD-9 based, there needs to be a crosswalk there, and the data needs to be mapped. So what we did for this particular customer was we figured out, we pulled out all the discrete values for those coding systems from both the source system and the target system, and did an automated mapping for anywhere where there's an exact match between those elements, but the customer had to work through any fallout there. So anything that didn't have an exact match that maybe required some clinical, somebody with a clinical background and required their input on, we facilitated that process through them, through providing them with a mapping application. So we had performed iteration testing with these folks, and really what that is testing all those different scenarios that they had concerns about. Bringing in the physicians once we start the testing to say, this is what you were concerned about. Does this address it? When you see the new data in the target system here, have your concerns been addressed? And really we make sure that everything passes in terms of that iteration testing before we go live and move the data into the target system. The last point in terms of our approach is, that we made sure to format and transform all the data so that it could be put into the Athena import requirements. And that's obviously part of our testing, and is making sure that it meets those requirements so that there's no issues on the inbound side, and we don't see all kinds of errors, formatting errors, or invalid mappings when the data is imported.
So then talk about the results if you could.
Yep. So the 2-month timeline, as you mentioned, Brian, that is a short timeline to be able to accomplish this. And I definitely wouldn't recommend putting yourself in that particular situation, if at all possible. However, because they did go with a solution that involved the archive portion, and weren't trying to bring over everything discreetly into the target system, and they had pretty simple requirements here of what they needed to be brought over and
how it needed to be accessed. We were able to successfully, within that 2-month time frame, meet their requirements so that all the information was available to them in the target system. We brought over the allergies, meds, problems, and as well as the immunizations and vitals discreetly into Athena, and then we archived all of their office notes and all of their scanned images, and they had observation terms as well. So, and we were able to do this, and one of the key things is to make sure that there's validation in place to make sure that all your errors are caught, so that was everything brought over successfully or not. And in this particular case, we were able to convert all of the modules with 100% accuracy and no data loss, which, as I mentioned, is really critical for ensuring for a conversion.
All right, well, we've saved plenty of time for questions, and we already have a number of questions from our audience that I'll share with our expert. I want to remind anyone who's listening that you can type questions into the chat area, and we'll share them with Brad here and get his expertise on that question for you. So let's begin with the first one. This is a little technical. Does conversion from Microsoft Excel sheets, not via vendors, API, or DB, bring additional complexity to the conversion process?
No, not really. It's essentially, in terms of the conversions that we do, we'll take data. Let's say all you can get is your data dumped from your EMR into Excel spreadsheets, and that's all you have to work with. There's no issue there. It's actually, sometimes that's easier than dealing with HL7 messages or CCDs. So it's gonna kind of depend upon how that data is structured within those Excel documents there, and is it pretty intuitive, and can I tell easily, where's my allergies, where's my problems. But in terms of adding complexity to the conversion, I'd definitely say not.
Here's another question, and this is about costs. The question is, what is the typical cost for a data conversion per physician? And my guess is that there's not exactly a typical cost because it's going to depend on what they want to do with the data. Tell us more if you could.
Yeah, that's exactly right. And so, with what the options are that are chosen there for a particular final solution, it's going to greatly impact your cost. As I mentioned there, there's discrete, there's summary document, there's there's archive there, and all of those come with a different cost and different level of complexity. So yeah, unfortunately, it is something I can't just throw out a number there and say that's the typical cost. It's really going to depend upon the solutions that are gone with, or, that are chosen there. I would be happy, for the person who asked that question to, if they want to send me an email, or follow up on that, to talk through what makes sense for their organization and give them some ballparks in terms of costs for the solution they're looking for.
And obviously there's going to be a lot of costs associated with putting in a new EMR that aren't, strictly speaking, data conversion costs. I mean, you're going to have the cost of the new system, loss of clinical time, that sort of thing. So that's a big transition for a lot of practices, I'm sure.
It is, yeah, and a lot of times, because they are, there's a lot of cost and time investment in just switching EMRs alone, but it has to be realized that there is a cost to moving that data as well, so and typically that's a big shock, to people, or to organizations. They say, we didn't even think about this, we didn't even think about the cost of migrating our data there. So so it's important to that is that people are educated that there is obviously a cost associated with that, but also that there's options associated with that. And you can look to, if cost is a major concern for your data migration, there's options that are pretty good solutions that can be done in a pretty cost-effective way.
So you deal with people who are going through these conversions all the time. This question is, why are people converting their EMR systems? And I like the question because it's kind of an ecology question in some ways. Like, is it around stage 2? Is it, what is prompting people? Is it that the clinicians don't like the program? Do you have a sense of what's involved?
Yeah, that's a wonderful question. So from our side, what we typically see is two of the main scenarios are that they really are really just not happy with their current EMR. As I mentioned in the beginning, there was a Black Book rankings study that came out that said, they were asking why are all these folks changing EMRs, because they had found that it was somewhere around 50% of practices were seeking a new EMR to move to in the year 2013 here. So, and their responses to that were that 80% of the people who were asked that question about why they're looking to change EMRs was around the fact that the current solution did not meet their needs. So it really is around dissatisfaction, typically, that we're seeing people looking to change EMRs. And some of the other responses that were given there is that that they didn't spend enough time evaluating that EMR prior to making the purchase, and so they really didn't understand its capabilities, and a lot of times as well that it's not suited for their particular specialty. So maybe it's a little too generic and doesn't allow them to do the things that they need it to do. So for the most part, it's around it not meeting their needs. Now, as I mentioned, acquisitions, we do a lot of conversions that are needed due to acquisitions as well. And those are probably the two main reasons that we hear in terms of people switching EMRs. Obviously, there is the the issue of not meeting certification and federal requirements there, but that seems to be typically a pretty minor reason people are looking to switch EMRs compared to the other reasons I mentioned.
Do you get the sense that a lot of folks sort of rush to buy EMRs, in 2011 or thereabouts, and now that they've had a couple of years of experience with the system, they're realizing that, like you were saying, that this really doesn't meet their needs?
Yeah, I mean, I think that with the government push there, with the HITECH Act, and to really get everybody up on EMRs there, moving from paper to an EMR, there probably were some pretty maybe rash decisions where not enough thought was put into what EMR is really most appropriate, for the organization. And there's a lot of EMRs out there. So there's a lot of good EMRs out there, and there's a lot of bad EMRs out there. So I think that as people, unfortunately, it's sort of for a lot of folks, it becomes sort of a taking a leap into an EMR there and realizing, this isn't really meeting my needs here. And what's critical though is that they're not stuck with it, and I think that's part of the message that I'm delivering here is don't feel that you're stuck with your EMR just because you went to one that you're not happy with. There are a lot of options in terms of moving and getting that data out of your old EMR and putting it into an EMR that's more suitable for your practice.
Here's a question about, I think he's talking about legacy systems here, but I'll just read it to you. Are you able to migrate data between two EMR systems only, or could you also migrate data from one LIS to another?
Sure. So it's going to depend upon the capabilities of those systems. So with EMR migrations, typically they have what are called filers. So you're typically just using an interface engine to get data into your target system, whether you're creating just CSV files or HL7 messages. And typically that data is going to be loaded through that interface engine. So
if with the LIS systems there, if it has the ability to, which most of them do, to consume the messages from outside sources via an interface engine, you certainly can perform a migration of that data. And also, what I wanted to mention there in terms of the archivals that are out there, it doesn't, the archival systems don't necessarily, you're not necessarily just limited to EMR data. You can house, data from LIS systems. You can house billing information. So really, any health system data, source data that you have, can be typically be stored in an archive solution. So yeah, just figured I'd mention that.
And I'm sorry, what's an LIS? I'm not familiar with that term, actually.
That's a lab system.
Oh, I see. So yeah, that actually raises an interesting point then, that there's a conversion of sort of that peripheral data as well to be done.
Correct. Yep. Yeah, exactly. And now, we typically, most of the conversions that we do are the EMR conversions, but we do have a few organizations that have decided to bring other health system data into the archive. So it's very common that people are looking to, EMR systems don't have everything. So, people need to consider those other ancillary systems and that data, and what's the strategy behind those as well.
So when it comes to an archive, that data, by definition is frozen. I assume that data is frozen forever. Does there come a point at which the archive needs to be discarded or phased out?
Well, not really. I mean, they can keep that data around. Typically, like I said, keeping it around for legal purposes is essential, for that. And in terms of its usage there, and how long, or how far back do they really need to go for, scanned images or whatever. I wouldn't say it's really a phasing out. It's really going to depend upon that particular practice and how long they need access to that data. Like I said, it's really just a link within their EMR there. Say they are 21 years later and really have no need for that. Of course, it can be, sort of just the archive can just be backed up and stored away somewhere. And it is static data. You're exactly right there. That data is not going to be typically not going to be changing unless you're adding new EMR, new legacy EMR systems to that particular archive.
So you could have data from more than one system potentially in the archive that then the live EMR would access data from both. Is that what you're saying?
That's one way to think about it, yeah. So basically, if there's an acquisition, let's say there's multiple acquisitions in a year, and with the first acquisition, they brought over, let's say, Allscripts into their archive, and with the second acquisition, they brought over eClinicalWorks into their archive. So they are adding data to their archive there, and let's say that they're on Athena. So Athena is now accessing the data from those. It's accessing the data from the archive, but that data doesn't actually live within the Athena database in that particular scenario. It's almost as if it lives within the Athena database because it's accessed directly from there, but it's not actually stored there. It can either be stored within the network of that particular practice or organization, or it can actually be stored in the cloud as well.
Here's another question about legacy archive data. It says, are the legacy archive EMR systems basically document management systems, or are they specific for each EMR system?
So that it was around the archive. That was what the question was.
Yeah. When it comes to the archives, are they distinct to the EMR, standalone? How do they work?
So the archive itself can house any any EMR system, any document management system, and the data that's stored within an archive can be both documents, scanned images, but it also stores that data discretely. So if you're pulling data from an EMR, a problems list or allergies list, that data is going to be stored in a table, within an archive solution there. So you can still get all the, the reporting and anything that you need to in terms of doing anything with that particular data. So yeah, it stores, and as I mentioned, it doesn't have to just store EMR data. It can store any type of data within the archive there. So yeah, we have just document management systems that are brought into there, but you're by no means limited to just the information in a document management system.
Well, I think we have time maybe for one more quick question before we need to wrap up on the hour. Okay, maybe this question isn't quick, but we'll give it a shot. So once the data is converted into the new EHR during a reporting period for meaningful use, how will you use the new EHR with that data to report to Medicare? So I guess the question is, meeting your meaningful use attestation requirements, can you rely on that legacy data? How does that present wrinkles?
Yeah, so obviously you want to bring over anything that's going to be needed for that reporting, right? So if you want to make sure that your reporting, if your reporting has to have everything, that is within your source system there, obviously you want to make sure to bring all that data over discreetly. You don't want to just bring over, the last 6 months or whatever. So you want to think about that in terms of the reports that are going to need to be generated out of the new EMR that you're on, and make sure that you move all that data into there. Otherwise, you're going to have to be reporting on, let's say you do keep it in an archive solution, you're going to have to be pulling data potentially from 2 different systems for your reporting, which isn't the end of the world, but it's obviously not ideal. So having that data, all the data that you need to report on in your new EMR is really what's critical there.
Well, as I said before, we do have limited time, but we're going to assemble all of the audience questions and post the answers from Brad on our site with links delivered via email later in the week. Thankfully, we were able to get to most of the questions. So I want to thank you, Brad, for joining us for today's Learning Lunch.
Okay. Well, thanks, Brian. It was a pleasure.
It was a very informative session, and I definitely feel like I have a much better grasp of data conversion with an EMR now than I did an hour ago. I'm sure our audience feels the same. To learn more about Health e-Formatics and the services they offer, please visit www.healtheformatics.com. You can see the URL there on your screen. And again, Brad will be reaching out to you to answer those questions that you asked. I'd also like to thank all of our attendees. Remember that all registered attendees will receive an email with links to both the slides and recorded versions of this session. So keep your eyes peeled for those slides and recorded version. For comprehensive training in meaningful use, register for Format Approved Certified Meaningful Use Professional course. The course covers the requirements for both Stage 1 and Stage 2 of meaningful use for both eligible professionals and eligible hospitals, including the Medicare and Medicaid incentive programs, along with clinical quality measures, HIPAA considerations, and more. Visit formatapproved.com/education/courses_cmup.html to register for the course. You can see that URL on your screen as well. Visit formatapproved.com to learn more about our upcoming Learning Lunches. The Learning Lunch button will take you to our entire slate of upcoming webinars. Our next Learning Lunch will air September 11th, and we'll cover the subject of secure HIPAA-compliant messaging in the healthcare environment. Keep an eye on your email box on our homepage for other upcoming topics, and thank you again for joining us today.